Hi, welcome back to Mike's Diabetes World. Current blood sugar is sitting at 8. Well, pretty stable. That's where my doctor truly would like me to be. Sometimes I like to be a little less, but I don't fiddle around with it. I have blood sugar I let the pump do a lot of corrections, and these are what the blue marks are here. That's a correction. That's where the pump's saying, hey, you know what? You may need a little tad bit more insulin to keep your blood sugar down, so I'm going to give it. This is with the 780G closed loop system. And what I'm talking about with the 780G is, let me sit down here. Let me grab it. Sorry, this is with this pump. This is a Medtronic 780 pump, which allows corrections and basal rates that change with your body's needs. So you're not getting so much insulin between a certain amount of time. It can regulate the basal rate. That also helps control. So it's all pretty good. Time and range is still not too much different from the last. I'm 9 above, 91% in range, and down here we're at 7.9 is the average blood sugar. This is the second video I've done today, and this number has dropped. So numbers are modified, and this can modify within 24 hours. You could go from 80 up to 100 based on the time of day you're looking at it. So don't be so discouraged. It's not worth it. Take the information and say, okay, there's something I've got to work on. Today, we're going to talk about budgeting and diabetes. Poof. So stay tuned. We'll be right back. This channel is provided for informational purposes only. Contact your physician for any diagnostic or treatment plan. Budgeting and type 1 diabetes. In Canada, or most of Canada, actually in all of Canada, we're covered by what's called pharmacare. And that means that a lot of the medications, the equipment we need as type 1 diabetics is covered. That doesn't mean you just walk into a drugstore and say, I want a 780G pump. And they'll say, okay, here you go. That's not quite how it works. But if your doctor prescribes, you can pretty well get any equipment, medication. You may have to wait a bit, but it will come. Insulin, you can get pretty quickly and it's paid for. In the States, it's not necessarily the same system. And in fact, we had people come up to Canada to buy medication, because even our list price are lower than in the States. The States recently, as far as the last presidential election, it was a topic of how expensive insulin can get. And insulin is very expensive. I have nothing against the pump manufacturers or the insulin providers or the glucometer people. making a profit, because that's the whole point of business. However, gouging is a different effect. And maybe I'll do a whole video on that. But today we're talking about how much of items you need and how you can budget for them. First of all, you need to set a realistic plan of what you need. You don't want to be in a situation where you're on your last bottle of insulin and you don't have another bottle of insulin ready to go. That is not a way of living with diabetes. Ideally, you should cover your medicals as soon as anytime you have money available. But don't go wild. Don't start stockpiling. If you stockpile, you're going to run out of time limits on products where they're not going to necessarily work at their finest for you. So how much product do you need? Well, again, everyone's different. My amount of insulin could be different from yours. Speak with your doctor. For myself, I like 3 weeks at least of product that I will have in my availability. 3 weeks is what I want and what I feel comfortable with. 1 week is can keep me going 1 week. 2 weeks, okay, if there's a shortage or anything. 3 is the optimum level for me. Can be different for you. Going for one thing to another, you could have a lot more emergencies which you're not going to be able to cover. What happens if your drugstore closes? Which in BC, one of our drugstores was hacked and they closed. You could get prescriptions, but I don't think you could make prescriptions. It was a mess. But if you're sitting there and you're holding on and you're having that bottle of insulin and you try to go to your pharmacy, which is closed, things aren't going to necessarily work out the greatest for you. Next, after you realize how much supplies you need to have on hand, you need to take a look at how are you going to be paying. Now, in Canada, health authorities across the province, and for those of you who aren't used to Canadian healthcare system, is each province runs its own healthcare. And in those provinces, they break them up into geographical areas called health authorities. And these health authorities take care of people living within the healthcare. My healthcare region is Fraser Health. They run pretty much all the programs that I need. Type billing and such that we have for Medicare, medications is all done by Pharmacare. Now, Pharmacare regulates the pricing and that Canadians or British Columbians here are able to get the medication they need. As a type 1 diabetic, I use an awful lot of medication. insulin is my lifeline, and it's probably yours as well. In the States, it's much more of a rush to get what you need. A lot of places in the States have gone to budgeting for you, saying, no, you can only get 2 bottles of insulin. I'm just pulling a number. I'm not using any scientific but they will set a limit and you can't purchase any more insulin than that. In British Columbia, we don't see a lot of it. You're able to get a moderate amount of insulin as required. People can say, oh yeah, we're spoiled. Because if I was in the States, in my predicament where I can't really work, that would take up a huge amount of my personal check. And I couldn't live that way. Where eating, medication, exercise, it's one of the main pillars of diabetic care. And if you're not able to meet those criteria, you're going to end up in a hospital, which is going to cost you more in the state. In Canada, Pharmacare takes care of hospitals. If you need the hospital, you can go. Doesn't mean that you go and you camp out in a hospital. No. It's a system that's not 100%, but it works well in our environment. Medical care in British Columbia is free. When we go to the doctor, we don't have to pay. Some specialties, like podiatry, have opted out of the system, and you have to pay a certain amount at the doctor's. Everyone is trying to survive, so budgeting is being realistic at your goals and what you need for your diabetic care. You don't go wild, because spending all your money to have all these supplies that you can keep in a cupboard and not use is not great. To help with budgeting, there's an idea that I learned years ago in a retail situation, and that is FIFA, first in, first out. Make sure you're always rotating your stock. I have a couple of boxes of sensors because this year I got a new pump and they sent me some sensors with it. So I keep rotating. New sensors come in, I utilize the old ones first. It just takes some organization. The one thing I learned, and probably the biggest thing I learned about diabetes is disease for the organized. When I first started, you had to keep meticulous records, and you had to pretty well cross-reference this line to that line, and it got really overwhelming. Now, we have systems that are able to do it for you. Oh, my sensor only has a day left. So Thursday morning, I will have to change my sensor. It's it's Wednesday when I'm taping this, so tomorrow morning we'll have to do a change of all my sensors. And diabetes care is expensive. So what we want to do is set our limits. How much items do you really need to have on hand that you're going to use in a certain period of time? Some people like to do a month. For me, 3 weeks. And I have a system where I count the items I have, able to go out and purchase what I need for that 3-week period, and I count them every week. So every week I have an order going to my drugstore. Well, I should say I used to. Now in this setting, my insulin's provided on an as-needed basis. I give what I want, a request to the nurse, and she brings me a couple of bottles of insulin. So this system, while in here, doesn't necessarily work for me anymore. It could still work for you. Count your items. See how much of these items you need in a 3-week period and order appropriately. That's the system that's worked for me. Years ago, it was called AIM in Accelerated Inventory Management. It's a system that works, and manually I can keep track. You can write a computer system if you want to determine how many items you need. Just eyeballing and say, oh yeah, I've got that, but I've got more over here. You physically have to count your items. You have to see and touch. This allows you to make sure that you know how much you actually have. And if you've used a lot more, double check your math. Trying to keep your costs down. Health authorities do it. You need to do it. In Canada, a lot is covered, but a lot of little extras aren't covered. Things like taping up my pump site. You can get fancy little taping things that you can tape the transmitters to your body. They cost a lot more than buying a package of what is called, and this is the brand name, Tegaderm. I have no relationship with Tegaderm, and that's what I use to cover my pump, and it works well. It's not as pretty and sophisticated. There's always ways you can find. You don't necessarily need the whole exciting brand name, but necessity can always find invention and what will work for you. Don't go crazy when you go to the drugstore, especially as being a new diabetic. Don't go crazy picking 50,000 items. Your doctor will give you a list probably as soon as you're diagnosed of what you physically need. Then you're able to go and start off, and then keep track of your inventory. Choose a time each week that works for you to produce an order. if you try to do it, you say you want to cover for a year, you're probably going to run into problems from your health authorities. They're trying to keep their costs down. You should try keeping your costs down by only having items that you need in order to live and safely live. You shouldn't have to be scrambling for diabetic supplies every 5 minutes. Be realistic in your goals. Find what you utilize and multiply it by the amount that you use by how much you need to have in stock. Sales covers what you need to bring in, and that can work for your diabetes. What you utilize every three weeks for myself, whatever works for you in your medical plans, can keep costs down, and you won't keep hitting that roadblock. Very few times have I hit a roadblock where I couldn't have insulin. This is another kind of part. This really isn't with budgeting, but something that could be is find a pharmacy that can deliver. That way, you don't always seem to have to be going to the grocery store unless you live like a couple of blocks away and the pharmacy and a drugstore works for you. That's awesome. But find one that can deliver, so if you're in a crunch. The whole point of budgeting for diabetes is making sure you come up with a system that you have enough supplies so you're not rushing. If you get down to a 1 week supply, that becomes your crisis time that you need to start ordering. You need to get on the case. You need to find financing for it. And like I said, in BC, we're kind of spoiled. Cost may be a feature in the States for some items. Be realistic. Know your capability of buying supplies and keep yourself well stocked so you have enough supplies that you can go to the cupboard and not like Mother Hubbard, your cupboard was bare, that you have supplies available. With that, have a great day and we'll talk later. Bye now. My next vlog topic will be Tomorrow's topic will be my low plan, and we'll discuss what my low plan is and can it work for you. Stay tuned, and we'll look forward to chatting with you again tomorrow. Low plan. My low plan. We've talked about plans before. Stay tuned. Have a great day, and we'll see you tomorrow. Bye now. My email is mikesdiabetesworld@gmail.com. mikesdiabetesworld@gmail.com.